Hi, I'm Dr. Somogyi, and I'm a plastic and reconstructive surgeon who focuses on breast reconstruction after cancer. I'd like to give you an overview today of some of the things we discuss with patients about breast reconstruction. In general, breast cancer, the surgical component of breast cancer treatment, is treated with a lumpectomy or a mastectomy. In another presentation, we talk about mastectomy reconstruction. In this one, we're going to focus on lumpectomy reconstruction. The lumpectomy refers to removal of the breast cancer alone while leaving the rest of the breast intact. This is a very common operation and in fact is more common for the treatment of breast cancer than mastectomy. In most cases, up to 80% of cases, removal of a small breast cancer, especially if it's in a larger breast, will result in no visible deformity and a small scar on the skin with no need for reconstruction. Where the plastic surgeon gets involved is in cases where the tumor is located in a very sensitive part of the breast, such as in the upper inner area, the so-called cleavage area. That can be a very sensitive area for a scar or for a small deformity, or if the breast is small and the tumor is large, and so again, there would be a significant amount of breast tissue missing. In those cases, a plastic surgeon can be involved to help fill in the potential deformity or rearrange the remaining breast tissue to provide a very normal, balanced shape to the breast. In some cases, when that procedure is performed and the treated breast is lifted or smaller because of the removal of the tumor and the reconstruction, a balancing procedure is performed on the contralateral or other side. So take, for example, if you have a right breast cancer in the upper inner area of the breast, and you have a B-cup breast, but the tumor is about the size of a golf ball, removal of that golf ball size tissue would leave a deformity in this area. What the plastic surgeon will do is draw a number of incisions on the breast that will look very much like a breast reduction or a breast lift. The nipple will move up, the breast will be a little bit smaller and lifted, and while doing that, the surgeon will be able to fill the proposed deformity with your existing breast tissue from the other part of the breast. In that case, the right breast will be lifted and a little bit smaller, and so the same procedure would be done on the left side to balance. So that breast would also be made a little bit smaller and a little bit lifted. That's called an oncoplastic breast reduction or breast lift, and it allows us to remove a fairly large tumor but restore a very normal breast shape. There is another category of lumpectomy reconstruction, which is called tissue replacement. As opposed to the previous one called tissue rearrangement, this is tissue replacement. In tissue replacement, some additional tissue is brought from somewhere near the breast and put into the breast to fill what could be a deformity. So in this example, again, let's say it's a right breast cancer and the tumor is out to the side of the breast, and it's a fairly large tumor in a relatively small breast. There may not be enough breast tissue to rearrange and to fill that proposed deformity. In that case, we can take a little bit of skin and fat from the side of the chest, the so-called bra roll. We can remove that, turn it around, and place it within where the defect is from the tumor removal, and that's called tissue replacement. Of course, that results in a scar along the bra line on the side of the chest, but it does restore the normal breast size and shape after the tumor removal. The nice aspect of this tissue replacement technique is that nothing usually needs to be done on the contralateral or the other side because we haven't really changed the shape or size of the breast. All of these procedures are done at the same time. In other words, at the time of the tumor removal, this lumpectomy reconstruction is performed, whether it's a tissue rearrangement, such as the breast reduction or breast lift, or it's a tissue replacement like the lateral chest wall flap or bra roll flap that I was describing. Aside from these procedures, many patients have lumpectomies and only down the road discover that they have a deformity or movement of the nipple out of position or something that makes the fact that they've had breast cancer surgery quite obvious. In those cases, this is a delayed reconstruction, and this is something that we can also look after. If it's a very small issue, then often fat grafting, which means removal of a little bit of fat from somewhere else in the body using liposuction and injecting it into the area of deformity can be enough. And if it's a larger deformity or the nipple really has to be moved, then we often will do something that resembles a breast lift or again a breast reduction to restore the shape. And if we do that on the one side, then oftentimes we'll do that on the other side. And so we try to look after any potential lumpectomy defects before they occur. In other words, with immediate reconstruction. But if there is a deformity after the fact, there are options for reconstruction as well. So I hope that gives you an overview of options for lumpectomy reconstruction.